Thank you for joining me today for another episode of the Healthy AF podcast. With me today is Dr. Rob Kominiarek. Rob, thank you for joining me.
Hey, great to be here, Zane.
Rob is the founder of Renue Health clinics. Working with people on really keeping them thriving forward as they age, but with all sorts of hormone health. Tell us a little bit about you and your practice and how'd you get into this line of work?
Oh, it's been a minute, but I'm focused mostly on men's health. We do treat an equal number of women. The practice is split about 60-40 and male to female. Focus is mostly on hormone replacement therapy and all the associated medications that may come along with that. So as I've aged and, now in 60, most of my practice focus, how do we keep that 40 to 75-year-old age group? How do we keep us moving forward? Because we grew up a little bit different, the Gen Xers, the baby boomers. We've been fortunate and blessed with a lot of medical advancements that our parents and grandparents didn't have access to. So how can we age a little bit slower and maybe last a little bit longer? Because when you look at the data, it's not great. Men, it's like 78, women, it's 82. So the closer you start getting to those means, you're like, I think you better be doing something.
Yeah.
And so we help people start to get a handle on the items that need to be taken care of. And more specifically, for men and women, what takes us out of the game more than anything else is heart disease. So a lot of our focus is towards heart disease. So prevention of major adverse cardiovascular events, heart attacks and strokes. So 1 in 3 men over the age of 40 die from a heart attack or stroke. 1 in 2.8 women postmenopausal die from a heart attack or stroke. So our focus is on how do we, improve hormone healthcare and all your healthcare in general so that you can live a long, productive life. And that last 20 years of life where all the disease and chronic problems show up, that we can mitigate that. And instead of having that slow glide path to death, maybe we can rectangularize that graph where we can keep you trucking along much longer and healthier for a greater period of time.
That's incredible. That's great. Yeah, and heart disease really is especially at that age group. That's
it's at any age. It's any age. Matter of fact, this week, I think 52 hemorrhagic stroke, 36-year-old with a heart attack. So the misnomer is that you can't have those things in the younger age groups where you most certainly can. It just, as you start to age, it becomes more and more prevalent. And when you look at the data, so many people are confused. They're like, they're more worried about breast cancer or colon cancer, but not that those aren't important. However, heart health really leads the number one way is how we all exit this earth. So what can you do to eliminate that, mitigate it to some degree?
And that works well with the hormone replacement therapy.
It does. And
That's great.
It feels good after, it's been prescribing testosterone since 1996, 97.
Wow.
And there were a lot of years there where it was attacked vehemently as a cause for heart attacks and strokes, which has been disproven. And we know it is good for cardiovascular health, neurovascular health, and so forth. So,
right.
Definitely feels to be vindicated.
Yeah. Yeah. No, it definitely has. I mean, I think a lot more is coming to the forefront now with the benefits of hormone replacement, just keeping the testosterone up at an optimal level.
Yeah, when you look at that data, being in the upper quartile for both men and women significantly improves your outlook with respect to cardiovasculars. We know if you're in the bottom quartile, the chances of major adverse cardiovascular events, heart attacks, and strokes are much greater, and for secondary events as well. So being in the upper quartile of the range is the best place to be. We don't want to just be normal. We want to be above that. Yep. We want to be optimal.
And I talk to a lot of people who go to their doctors, like their general practitioner, and say, "Oh, you're normal." I had one guy, he's 47 at the time, which was doc, who was probably closer to 30. He said, "Oh, your testosterone's higher than mine. What are you worried about?" And when he showed me what it was, I thought, you definitely could use some help, and you'd feel a lot better. But it was, that the 30-year-old GP was his point of view or perspective was like, oh, it's in the normal ranges. You're fine. It's got to be something
Yeah,
else.
so that's a broad, saying normal range. What
Yeah.
really is normal range? You can look at the laboratory parameters, but there's so many other factors that come into play with respect to hormones. And that's all the hormones: receptor site sensitivity issues, genetic issues, CAG length, sequencing, all these other components come into play. So you can still have a quote unquote normal level, but still suffer all the symptoms of a hormone deficiency, even though they can be in the normal levels. The question is what's the treatment going to be? And oftentimes we'll have to challenge people a little bit because we need to understand why they're having their symptoms. And sometimes we can find very obvious issues where it's a heavy metal toxicity or some kind of medication use. So now their low levels of hormones are due to the fact that they're on a medication that's suppressing them. And the removal of that medication, the hormone levels come back. So we see quite a bit of that. So sometimes it's not about actually replacing it. It's about removing the offending toxin or medication that's actually lowering. Statins, opioids, ADD medications, antidepressants, anxiolytics can all negatively impact hormone production. So sometimes it's getting rid of certain medications or making adjustments to it.
So you mentioned statins. I mean, and we're talking about heart health, and of course, statins are the mainstream, first tool of attack for
what they put in the water, right? Just in
Right.
the public water system. They
Yeah.
just drop the tablets in there. Yeah, they're definitely, in my opinion, grossly overused, especially when you look at the data and who they really benefit. They do certainly have clinical utility, and I do use them and recommend them at certain given times, depending on the patient and what they need to use. But there's other alternatives as well. There's the PCSK9 inhibitors, and then you have bempedoic acid and ezetimibe. So there's different ones that we can use to work around the issue. But in general, statins will decrease hormone production. In particular, testosterone really falls off. So that would be an example of medication-induced hypogonadism.
Is that because of the impact on the cholesterol production that leads to, which is then
Right,
used
so-
as a foundation for the hormones?
It's a backbone. It's a backbone to hormone production, to the bilipid membrane layer of the trillions of cells that make up Zane are made from cholesterol. Your brain, it's all cholesterol. So if you're going to reduce those, there is going to be some impact along somewhere.
Wow. And you mentioned marijuana use, which is actually getting very popular now and being
Super
legal
popular.
in a lot of
But
states.
unfortunately, the excessive use of marijuana will decline testosterone production. You see a lot of it, especially in young males that have anxiety issues that use marijuana to try and calm themselves. And they go, oh, well, it's medically approved to be used for these things. Sure. And there may be clinical utility for the use of it, but it does come with negative hormonal impacts with chronic use. And so you have to be able, what's the trade-off? Is there something else I could be using, or is this really the solution to my problem? Recreational use or recreational abuse of these substances definitely lead to low testosterone and all the associated symptoms that go along with that. It's really, for me, it's disturbing to see a 21 or 22-year-old who should be sexually active, have no trouble with erections, be strongly motivated, chasing girls and having a good time, and they're not thinking about that. They're just flat. And, you're in my decade, right? Close to my decade. So you understand how we grew up. I mean,
We went, we were in, almost borderline insanity with this whole testosterone. And making really stupid decisions all the time from it. But yet that was part
somehow
of,
I made it past 26. I've been without.
Yeah. You count back and go, whoa, that was closer than I realized. But, it's just, we were just going. It was like gasoline in our veins. And there is a difference now. It's like there's a very strong difference in level of motivation and drive and desire. It just seems really odd. And I mean, just coming across in my own, work with my wife, it's young guys with low testosterone, high stress level, high cortisol levels. And it's just, you're just scratching your head like, what's going on here? And so you're seeing it in your practice as well with the younger guys with low T, probably with a number of factors involved, I would imagine.
That's
But
never just one thing. Sometimes there's a very identifiable cause, a medication or substance abuse. But oftentimes you'll see these younger patients and you can't put your finger on, exactly what is it? Is it some medication? Well, they're not on anything. Heavy metal toxicities, exposure to phthalates, medications, and vaccines. What in particular caused the issue? And like I said, back in the 90s, early 2000s, most of the patients I would see with low testosterone were 45, 50 older and had identifiable causes: chemotherapy, radiation, trauma, some cancer. So it was like, okay, that makes sense.
Wow. So it's younger and younger. I would assume vitamin D is a big part of
Yeah,
that.
one of
There's
the
a lot of
it's
low T.
the pro hormone that's incredibly important, right? It's the school bus that helps drive everything into the cell, responsible for, 400 plus, enzymatic processes in the body. So you really want to have all those major players taken care of, testosterone, free testosterone, estradiol, DHT, testosterone, or vitamin D, growth hormone. So the major players, cortisol, thyroid, having all those working appropriately in your favor, but you have to have all the basic things in check as well. Really, when it gets down to it, healthy living and the things that you need to do can be pretty boring. It's not exciting. Because the foundational items are what really set the foundation for improved health and long-term health. And that's recuperative, regenerative, restorative sleep, right? Not exciting, but
No.
having, a nice sleep schedule and good sleep hygiene so that you get good sleep on a daily basis. Exercise that's appropriate for your age group. And as we age, we have to think about different things such as, protecting our bodies from injury, because it takes so much longer to come back from an injury than, say, when you're in your 20s, and making sure that you have enough recovery time. So sleep, exercise, restorative practices. What are you doing to lower your stress? Is it prayer, meditation, Tai Chi, yoga, goat yoga, whatever it might be?
Right.
But how are you going to lower those stress levels? Because stress is a major, major killer. And I see it as one of the differentiating factors in patients all the time. Having diagnostic studies, meaningful diagnostic studies done on an annual basis, looking at your nutrition and cycling through your nutrition. So are you really eating healthful? Is there too much processed food? Is there too much sugar? Are you rotating from carnivore to keto or Mediterranean diet and using all those different modalities? And then genetic testing. What can you find in your own particular genetics that you can modify or improve upon or protect yourself from, for example? So those are the items that we have direct, indirect control over that can dramatically impact our health. But none of those things are super exciting. They don't require the latest, greatest supplement or exercise tool. And if people would focus on those items, and more often than not, when I talk to them, those are the things that are out of whack. Not had appropriate diagnostic study, not getting good sleep, poor nutrition, too much alcohol, smoking, overweight, and correcting those items will do more for your longevity and your overall health and wellness than any medication. Right? If you're not taking care of those things, there is no hormone or supplement that I can give you that will overcome poor lifestyle habits and poor dietary habits. So those all have to be in check. And I'm not saying you can't enjoy yourself and have soul food every now and then, but 90% of the time you need to be taking care of yourself.
Absolutely.
Yeah, you can't out hack those foundational elements of movement, diet, and recovery. Those can't be out hacked. There's no amount of
No,
I've seen people try. They add the testosterone. They just gain weight and they gain water weight, and they don't, nothing changes because they still, eat the crappy food and drinking too much and not resting. And it's amazing. Well, I would imagine alcohol. So that's, I know a lot of guys, they can't sleep, so they have a couple drinks before bed. That's like, obviously gets them to sleep, but then jacks up their sleep somewhere, 2 or 3 a.m. How much of an impact are you seeing with alcohol being an issue?
So I don't want to sound like a complete stick in the mud because I had my moment in the sun, but then you come to realization like, hey, wait a minute, this is a cardiotoxin. This is a neurotoxin. It
Right.
does nothing for my health. So when you adjust your perspective, how does this benefit me? Exactly how does it do that? And having worked in the emergency rooms and taking care of patients over the year, it is this exact same cautionary tale that I've seen repeated over and over and over. Busiest day in the emergency room, Wednesday afternoons, 5 o'clock, here come all the guys that have been drinking on the golf course. They're dehydrated and now they're in AFib, right? So they either get chemically cardioverted, electrically cardioverted, and now they're on medication because they were drinking too much alcohol for too many years, right? It's a cardiotoxin. It's also a neurotoxin. So if you're looking at improving your overall health and wellness, eliminating or even limiting alcohol consumption is definitely something you want to do. Well, I have a glass of wine every now and then, but very rarely. Very rarely.
I found the same as I got past 50. If I wanted to sleep well,
Yep.
the alcohol couldn't be part
Gotta
of my life.
Yeah. And recovery. Just,
Yeah.
I don't like,
Exactly.
for me personally, more than a glass. And I'm not talking the American pour. I'm talking like European, right? Like 6 ounces. Nothing major, 4 to 6
Not
ounces.
the home pour for
Yeah. Not the American decanter whole bottle.
Yeah.
Right. That's enough. That's more than enough for me. Because then the next day I'm kind of just a little bit off, a little bit sluggish. And I don't want to be. Can't make more time. So
Nope. If you invest in your health, you might get more time, but
Yeah.
basically that's it. So the big kind of elephant in the room for the last few decades with testosterone replacement therapy has always been, prostate cancer. And I think we're seeing more and more come out now where it's like, I'm seeing that's really the opposite of what we've been hearing for the last few decades, which is that there's no problem with hormone replacement therapy where people are either post treatment prostate cancer or they're certainly not seeing it at causal. There was no room to say that testosterone replacement therapy caused some sort of issue with PSA or cancer. But I'd love to,
So
I'd love to hear from you.
testosterone cancer does not cause cancer. There may be certain instances where we need to hold back testosterone therapy from somebody under treatment, but we also do use what's called bipolar therapy, where we use testosterone and estrogen during treatment and cycle them. But the old myth or wives' tale, I think, has long been dispelled at this point that testosterone therapy causes prostate cancer. And I think all the work that Abraham Morgentaler has done and others has proven that testosterone is protective. Higher levels of testosterone as we age is actually protective of the prostate. Now, there are going to be certain outliers and certain individuals that have cancers that have to be dealt with that may need some deprivation therapy at times. But I treat a lot of post-prostate cancer patients with testosterone, and they do very, very well. So at some point, it'll have to be replaced, especially if things have, depending on what their issues are. And all those have to be taken, all those patients have to be taken on as a case-by-case patient, because there's all these unique variables that everybody has. So.
Sure. It's been such
it was a hot button topic
for
some time, but I think at this point it's been fairly well dispelled, and that myth, just like testosterone causes heart attacks and strokes.
Right.
There was all the rage around 2016. It's like, well, now you find out you have randomized controlled or studies that were meta-analysis of data that were statistically manipulating into achieving their point. And flat out, the investigators lied in these studies. They didn't tell the truth. They just wanted it to fit their agenda. And those of us, for me, I'm in my 30th year this year of using testosterone. If that was the case, then I would be seeing hundreds of men and women dying from heart attacks or strokes with the use of therapy. And that has not been the case. I've not clinically seen that, and that's supported by the data, by all the studies. I see exactly the opposite. I see men in particular who've suffered major adverse cardiovascular events live very longer and productive lives by optimizing their hormones.
Absolutely. Well, can we talk about maybe, going to be some people listening who maybe they're not sure if what they're feeling is low T or if it's just kind of fatigue, because men's testosterone tends to slowly decline over time, but it varies when it comes in. So let's maybe talk about
in general, it slowly declines. Sometimes the precipitating factor can create such an insult that it drops off. So like head trauma, for example, or heavy metal toxicity or radiation, chemotherapy. Iron, for example. So people that have their own well water, iron can be a problem, can drop off testosterone. So it can be slow, or it can happen literally within a couple months. Or
really? Wow.
Yeah. All the symptoms generally tend to be the same. More often than not, men complain, and you wouldn't think, but it's mental fog and fatigue. So I'm just not as sharp. Like I can't seem to, I know what I want to say or what I'm thinking, but it's just not as fast as it used to be. And to the casual observer, they won't notice it, but the person suffering from the symptom, they feel it. Like I am just not sharp. It's almost like when you have a head cold and you've taken cold medicine and you're kind of foggy in the brain.
Right.
That's what it'll feel like. So brain fog, fatigue, gaining fat around the middle, losing muscle mass, decrease in libido, decreased sense of well-being. And it's more often than not, it's that decreased sense of well-being, the brain fog and fatigue are what drive men to come in. Then you need to have some objective evidence, and that's where the lab comes in. We take a look at the laboratory, and then you can say, based on the labs, what we see and your subjective complaints, it looks like you're suffering from deficiency of XYZ hormone, whatever it might be. So let's trial this hormone for 3 to 6 months and see how you do.
Gotcha. So you're looking for like low total, low free testosterone?
Well, the free, not so much the
free.
total, right? What's your free testosterone look like? And then you have to take into consideration receptor site sensitivity and how sensitive is the cell to the hormone. And what have they been exposed to chemically, medicinally? What have they taken substances, recreational substances that cause the problem? If they're a heavy drinker. So, I can give you testosterone, but if you continue to keep drinking, well, that doesn't help. So we need to remove those items. Sometimes we can find an offending agent and we can get it removed, and other times we can't. Sometimes it's just, well, you have low testosterone. I don't know exactly why. And then we're going to have to consider replacement therapy. And I may take a stair-step approach to that therapy because there may be some reserve left between the hypothalamus, the pituitary, and the testicles, where we can use something like HCG or a selective estrogen receptor modulator to boost their natural levels to see if we can get their system doing what it does naturally. And then if it can't, we can say, well, hey, we tried the HCG, we tried the enclomiphene or Clomid. That didn't do the trick. Let's move to the big tool in the toolbox, which would be testosterone, and let's actually start replacement therapy and see if we can resolve your symptoms.
Gotcha. Yeah, that makes sense. Well, I think past a certain age, maybe those other early treatments would work more so for younger guys, seem to work better for younger guys.
They can. And sometimes you have to use the bigger tool in the toolbox. But what's always interesting to me is when I get 75, 80-year-old patients in and they've read the newspapers, they've heard the news, and they want to get their testosterone checked, and they come in here and it's like 900.
Whoa.
With a free of 20, and they're 85 years old. So it's really interesting to see the older generation, and they're 20 years older than me, with really high levels. And you have to ask yourself, when they grew up, what were they not exposed to? What did they not take? And they certainly live a different lifestyle and aren't usually exposing themselves to numerous medicinal agents, ate healthy, didn't have an aggressive vaccine schedule. So you start taking a look at all these things and go, well, why is it that we see all these, in the winter of their years with high
Right.
testosterone levels, but yet I have a 24-year-old in the office with a 197 and a free of 6.
Yes, weird anomalies. Yeah, I've heard of that with a couple guys I know who are 60-ish and who have the 900 free, total T and a high free T around 20 or so, and they don't take anything for, and they're just but they're very high driving. Actually, two of them I know are stand-up comedians, like you'd have heard of, and they're out in front of the public, and you got to think. I wonder if that's part of their success. They're just like, they got a lot of testosterone. They can stand in front of a crowd and just,
Yeah.
They're at 60 years old, they're still strong like that. And you think they're anomalies. Now they're anomalies. Who knows?
Yeah, a little bit so, because it's amazing how my patient population has changed over the years, and how I see younger and younger men for that therapy. When you think it would be older, and it's not. And I get guys, like 60 years old, I still get guys in my age group, and we check them, and I'm like, you're fine. You're running 700 with a free of 18, you're good.
Yeah, no, that's amazing. That's amazing. Now with women, I mean, I think a lot of people are catching on to the fact, but women really benefit from not only to the progesterone, the estrogen therapy for menopause or perimenopause, but with testosterone replacement as well.
Absolutely.
Yeah.
It's one of the first hormones, if not the first hormone in the middle 30s that falls off in women. And there's a lot of substantial benefit from reduced skin wrinkles, which women love that one.
Yeah.
Like, oh, you mean, and you know what? Let me tell you, just a teeny bit, like size of an eraser head right through
Really?
here. Oh, yeah. Tightens, keeps the wrinkles away.
Of the testosterone?
Yeah.
Good to know.
So it's good, for libido. It's good for fat loss. It's good for muscle retention. Helps combat hypoactive sexual desire disorder. Testosterone in and of itself is apoptotic to breast cancer cells. So there's a lot of good studies that demonstrate that having a higher level of testosterone is protective of breast tissue from cancer. So there's an extreme amount of benefit for women to be using testosterone. And like I said, it's one of the first hormones that falls off. It falls off in a kind of predictable fashion. So testosterone first, and we see some waxing, waning of progesterone and estrogen until that final stage where we have to think about replacement. So,
yeah, I've seen it. My wife, actually, the first one she started with, and it was amazing. She didn't change much else in her lifestyle. Like she was she's like 49-ish at that point, but she didn't change much. But she'd noticed like, oh, there's a little kind of lethargic, a little extra weight. Within 3 months through the winter, without, not changing diet, exercise, much else, because it was pretty on, 20 pounds fell off of her, and it was like, she just needed that little extra edge. And so now she's working with a lot of women who are really, like you said, starts at mid 30s, but a lot of them late 30s into their 40s, they aren't menopausal yet. And you get a little bit of thyroid, a little bit of testosterone, and they're like waking up like, oh my gosh, I remember when I used to feel this good. And then they're chasing their husbands around. It's like, you need to get yours checked because you need to keep up with me. And it's kind of funny. They're like getting their husbands because like, hey, I'm feeling good now, and I need you to feel good too.
That's very interesting because men feel testosterone, women feel thyroid. That's generally how that works. So it's like with women, we'll take a close look at the thyroid, especially being in the Midwest. There's usually low iodine consumption, so that usually drives thyroid symptoms. And if you can't get somebody to eat more fish, it's like, well, we have to look at some supplementation, see if we can get that moving. But in general, women feel thyroid, men feel testosterone. And when those are off and you put them back in, it's like Miracle World. Things take off right away.
Yeah. Yeah, they feel amazing. My wife likes hers a little higher than typical range, right? I could tell when hers drops down low.
Yeah, for most women, 4 to 6. That's that ideal range where they perform the best, feel the best without getting any of the unwanted side effects of extra testosterone.
Yeah. Yeah. She's actually she has this little
They're a little bit higher than 6.
And she feels
That's
great.
fine.
Yeah.
Yeah,
like
as long
closer
as
to
you're not
10.
having the unwanted side effects, that's absolutely fine. And that'll be variable between individuals. But
Yeah. It's very individual. That's what I've seen. Some people are real happy right at 4 to 6 and some like a little bit more. I had one client, she was a singer and she was worried, so a lot of women are worried about their voice and the hair, and she was professional, like Broadway singer, still singing, still performing in her mid-50s. But within a year of of adding testosterone to her hormone profile, she's hitting notes she hasn't hit since her 30s. She's hitting her high C's. She's recovering better from her performances. She's not getting sick when she travels. Like there's a lot of strain on her voice, and her voice starts
well,
to
it's
go
a good
out.
thing she didn't go from like soprano to tenor. I mean,
No. She's hitting
you
the
have to
high
be
notes. And
careful.
yeah. No, it was like just what she had for her body recover. She wasn't have a strained voice after 2 or 3 days of performing.
Yeah,
And so it's amazing,
Yeah.
and
You do have to be careful because the vocal cord thickening that can occur with testosterone therapy
Mhm.
can be permanent. Sometimes it's not
Mm.
easy to. So you have to watch carefully. But in general, if you start getting a little extra greasy skin or thinning hair, then you need to back off a little bit. So.
Sure. But there's definitely, I'd say, more benefit than
Absolutely. Very rarely do I see those issues. It's only if you take it to the extremes.
Gotcha. That's great. So I'm sure you've seen a lot of like couples that come in and kind of
I've seen
revive their,
yeah.
kind of get things revived, and right, one drags the other in, like you got to do this where we both need to feel good. That's amazing. That's awesome.
Yeah.
What else?
You can always tell when the wife loves the husband.
Yeah.
It always shines through. Yep.
That's true. They're dragging them in. Yeah. So what other how else do you address this asset beyond the hormone replacement? What else are you seeing as real beneficial for the longevity and just for lifestyle, just for enjoying life?
Yeah. Once again, foundational items. They're not sexy. It's not exciting.
Yeah.
But getting those items taken care of and being consistent with them,
Mhm.
with sleep, with your exercise, with your restorative practices, doing your diagnostics on an annual basis so you can discover anything that changes early so you can make changes sooner rather than later. And then nutrition, and I'm a fan of genetic testing, so you can look at your personal genetics and make adaptations to how you live your life and supplements and medications that can be beneficial. And then all the new therapies that are out there, in particular peptide therapies, which have a lot of utility and incredibly safe and very, very beneficial.
Do you offer peptide therapies as well?
We do. I'm very strategic with the peptides.
Mhm.
In particular, I like the growth hormone secretagogues. Then there's your repair peptides that do really well. So
like epimorelin, tesamorelin, is that what you're talking about?
Yeah, I prefer tesamorelin, the third generation growth hormone secretagogue. Works well, lowers LDL, raises HDL, decreases carotid intermediate thickness, improves muscle mass, strength, endurance, sense of well-being. I mean, there's a reason why it's called the middle-aged man's miracle medicine, because it really does a lot of great things. There's an incredible amount of benefit from that peptide.
From
And
the
then all the
tesamorelin.
other peptides that have really come out of the market in the last decade that are incredibly beneficial, have a lot of utility if they're used strategically, right? Just not willy-nilly.
Gotcha. So I would imagine you're looking at metabolic health as well, as far as like insulin levels and so forth. So
Exactly.
you say a higher fasting insulin is probably going to be have an impact on hormone production, or
Check mark for a problem, right? So we start running down the list. Higher fasted insulin, that's a problem. Higher fasted glucose, that's a problem. High homocysteines, elevated high sensitivity CRPs, skewed lipid panels. We'll look at all those items. Elevated LP-PLA2s, fibrinogens, MPOs, LP-A's, elevated oxidized LDL. So all these factors we'll put together, because in the end, if you're going to win the game at longevity, it's really going to be about pushing heart disease away. And how are you going to eliminate heart disease? Because that's the number one killer for both men and women. So
gotcha.
most of my efforts are geared towards, determining what's your 10-week risk for heart attack and stroke? What's your 10-month risk? What's your 10-year risk? And what group are we putting you in? And based on that, we're going to decide how aggressive we need to be with what therapies to right the ship and get you headed in the correct direction. I mean, today I had a 36-year-old who had a heart attack.
Wow.
So, I mean, it can happen at any age. There's a misnomer that it just happens to old people.
Right. Well, it used to be kind of that over 50, right? And then now it seems like it's getting younger and younger. It's
hard to think of 36 to 38 being middle age, but it is.
Oof.
That's like a baseball bat to the knee.
It really is. That's not what you want to think.
No. But when you're 40, I mean, you're really middle aged. You're actually beyond it, but yeah. So you need to start thinking early. It's better to be doing something sooner than later. That way you can extend the runway in front of you.
Yeah. Or starting, like you said, with the lifestyle choices so that you're mitigating risk. I mean, you really can't manage metabolic disease and expect longevity and health as you get older. You got to eliminate it, prevent it. It's not something you want to like live with and manage.
If you're going to have a bottle of red wine every night, I can't overcome that. I can't. It doesn't matter what I give you. Right. Unless you make the lifestyle changes.
Gotcha.
It's like peeing into the wind. It's a bad idea.
Right. There's not a whole lot you can do about the side effect of that.
Right.
So where are your offices? Let's tell us about where people can like reach out and
the main office is here in Ohio, and I travel around between North Carolina and Florida. Right now, I'm up in the Ohio office and getting ready for an ice storm that's coming this way. But that's gonna hit that whole section of the country. But
it looks like it looks pretty nasty.
We'll see what happens here Wednesday, Thursday. But
I gotcha. So Ohio, North Carolina, and Naples,
Florida.
Right? Yeah, that's fantastic. Well, I mean, how can people find more about you and reach out to you?
Yeah, super easy. Just go to renuehealth.com. It's RENUE health.com. And you can reach out through the website. The staff will take care of you. They have on the site, it has all the forms to fill out, and just email it in and the staff will get a hold of it and reach out and contact you. We're pretty easy to get a hold of.
I'll have that in the show notes. So I know I saw you first on Instagram, where you're Dr. Rob Kominiarek on Instagram, when you share quite a bit.
That's an old dog learning new tricks, boy. That Instagram, I have to laugh.
I'm with you. Yeah, it takes some time, but you have great. I mean, you have great content. That's kind of where you stood out to me.
Good, thank you. I appreciate that.
As being very consistent and
try to take an educational standpoint and steer people in the correct direction. It's hard to take a subject such as longevity and health and wellness, which is quite honestly, everyone tries to jazz it up and make it exciting, but the reality is it's not. There's nothing exciting about it. The foundational items are the foundational items, and you need to get those things straight. I like to tell people, shoot from the hip and tell them like it is. I don't really want to sugarcoat it, try and make it sound fancier than it is, trying to chase down the latest, greatest supplement as that's going to be the magic pill that's going to fix all your problems. That's not the case. There are certainly medications and supplements out there that can help you achieve your goals, but you've got to have the foundation in check as well.
Very good. I agree, 100%. I tell people, can't out-hack those. Can't out-hack those foundational choices, lifestyle choices. They are pretty boring, and it's really dependent on how consistent you are week after week after week after week. That's what's going to make the biggest difference, the biggest leverage point.
Discipline plus consistency, daily habits equals the win.
Yeah.
Every time.
Yeah. Everything else is kind of icing and a little extra. That's awesome. Well, thank you again for your time. I appreciate you sharing everything. And again, we'll have the link in the show notes, but appreciate your time and your wisdom. You've got decades in this field, and that's hard to find.
It's been a minute.
Yeah. I mean, as you said, it's been decades, but that sets you apart, because there's a lot of newcomers who seem to just, I mean, let's face it, becomes all about biceps and boners for a lot of them. It's just kind of very Like,
That's what sells.
I mean, it sells, but it's not the big picture of,
Yeah.
and that's what stood out. It was that you have a lifestyle approach and you understand what those foundations do and are, and the importance of them, and that they need to be in place, or you're pissing in the wind. So that stands out with you, and that's why I wanted to have you on and discuss this.
Thank
topic.
you very
So,
much.
yeah. Right. Well, good luck with the snowstorm, Dr. Rob.
Yeah. Thanks.